Welcome to another edition of Health Matters, a presentation by the Ministry of Health. Recently, the President would have signed a proclamation or document that lifted many of the restrictions for COVID-19. I've got with me in the studio Colonel Najrul Hussain, the director of the COVID-19 Taskforce. We find out more about these ease and restrictions and what it means for us as we're still in the pandemic of COVID-19. Colonel, welcome to our program. Before we talk about measures, people out there might still be wondering, well, what is the COVID-19 Taskforce? There have been so many stories that they've seen on media, television, newspapers, and of course, in social media, so many stories. Tell us a bit about the COVID-19 Task Force.
Okay, the COVID-19 Task Force was set up as a mechanism to deal with with COVID in 2020. I was with the Secretariat from March of 2020, transitioned with the government to the new leadership. The Prime Minister is the chairman of the National COVID-19 Task Force. The co-chair is the Minister of Health, Dr. Frank Anthony. And we have, with the task force, members of the security agencies, other public regulatory bodies, and also the private sector is on board with us. We also have members of the opposition on the task force. So the task force is basically at the national level. We monitor the policies and implement policies of government to deal with COVID-19. And to help us in a decentralized way, we also have the regional task forces, which are all headed by the regional chairman from 1 to 10. So we have that mechanism in place. There is feedback mechanism. There is policy guidelines that goes out to the various regions, depending on the peculiarity and the situation out there.
A lot of people, made a lot of critical remarks about COVID-19 Task Force, especially in certain regions. How would you respond to those criticisms, especially when the enforcement component of the task force?
Well, basically, the task force, we embody the 4 E's: education, engagement, encouragement, and enforcement. So I think we have been doing well with 3 of the E's. The only one that people do have a problem with is the enforcement. And that is where, the task force would have to come down sometimes in a heavy-handed way on some of the deviant behavior of some of the persons who do not adhere to the guidelines. So I think that is where we have the issues and the negative comments.
Mm-hmm. Did you see that the enforcement of the guidelines might have had that impact in terms of deaths and those persons who were tested positive? Could it have been out of control if there wasn't enforcement?
Of course, enforcement was necessary because the persons who were having COVID the majority of the persons were between the ages of 20 to 35, mm-hmm. and they were the people actively in the workforce and also going out for entertainment activities. And when they get home, they pass on the COVID to their, the elders in the home. And that is why we had a lot of elderly dying out because of their comorbidities. They could cope with COVID. The young ones, being more resilient, mm-hmm. they were able to, withstand the disease. But the older folks, they suffered because they had their other comorbidities, their other things that affected their health. And that's why we have more deaths in that category.
Was it easy monitoring in the far-flung regions, especially when you're looking in the different communities, region 1, 7, 8, 9? Was there any difficulties in monitoring those areas?
Yes, we had difficulties because, remember, some of the challenges came from activities that are, peculiar to some of those regions. And some groups, for commercial reasons and so on, they would ask for some party, some kind of fair or something, and it goes out of hand. So the police has to get involved, and it's difficult to monitor. But we've had a working relationship with the police, the commanders. We are all, in the same alignment, and where social activities were concerned, most of the permission would have come from the task force at that time.
Mm-hmm. Okay, so we'll take a break. We are talking to Colonel Nasrul Hussain, Director of the COVID-19 Task Force. When we come back, we'll have more for you.
Vaccinated or not, keep up your guard against COVID-19. Keep your distance. A message from the Ministry of Health and PAHO WHO.
So it's almost 2 years, if not 2 years, since the task force has been established. And every month from the Attorney General's chambers, we would have seen these gazetted orders coming through, but from curfews to how people would be in gatherings in terms of restaurants and places of worship and so forth. And it has evolved into now March 2022, where certain, of these restrictions, are now lifted. I can remember the interview with someone was doing an interview with Attorney General Nandalal, and he said at one time the document, the gazette, was 17 pages. Now it's down to 4 pages. That's some serious restrictions. But tell us a bit about some of these restrictions that are lifted in the current Gazette.
Well, the purpose or the aim of having the restrictions were to modify public behavior, to curb the spread of COVID. So that's why we had a ban on public gatherings and such. As a matter of fact, we started off by having the lockdown. But as the situation improved, based on the epidemiological situation, we were able to understand how you can slowly lift some of the restrictions in order to allow people to move on with their lives. So we were looking at what was necessary and what wasn't necessary. For example, we found that weddings were important. It helped people to move on with their lives. And to cope. So we allowed weddings, whereas we didn't allow parties. And of course, as time moved on, we were able to allow for the opening of restaurants and bars, up to a limited capacity. And as we moved on, we had vaccination, and that also encouraged us and allowed us to open up some more. So what the task force was doing, and based on government policies, we were looking at the science and slowly but surely opening up in order to allow people to come back to normalcy. So here we are with a minimal number of restrictions, which entails travel restrictions, and that has international repercussions. And whether you're traveling to Guyana or from Guyana. So those requirements have remained in the measures. You still have to be vaccinated to travel, and you're still required to have a negative COVID test. That is what protects us from having other cases coming into the country. And likewise, that protects the other countries from having positive cases go to their country. So that is one of the biggest measure that is in place right now. Internally, we have removed that restriction, right, of having a vaccination to travel. We did have it on domestic flights. That hasn't been removed. So basically, most of the measures...
Go back to that again. Domestic flights only.
No, there's no requirement for vaccine for domestic flights.
Right. But people going out should have...
Once you're leaving the country. Or coming into the country.
Right.
And that depends on the requirement of the destination.
Right.
But coming into Guyana, we require you to be fully vaccinated and to have a negative PCR or antigen or rapid tests, less than 72 hours.
All right. The whole idea of restrictions also, and quite a few people apparently liken to the idea. The Gazette doesn't speak too much about social distancing, but it speaks specifically to masks as being an option. What can we gather from that?
Well, as I said, based on the science, if the COVID is in a recessive mode in this part of the world at this point in time, because we have seen variants come in and spiking our numbers, that helps us to decide. Well, yes, we can let go of the mask, but not completely. So that's how we differentiate between mandatory and encouraging to still use it. So if you feel that you're at risk, definitely you should use the mask. Or if you feel that you will put people at risk because of your symptoms, well, definitely it's there. So you wouldn't look too odd going out there with your mask, right? Because there's no requirement. Yes, there are still requirements. For example, that's the government's position. Mask is not mandatory, but there's still the private sector, and they're looking at their health and safety regulations, the Occupational Health and Safety Act, and they are demanding that their workers should be vaccinated, or they should wear mask or other PPEs, personal protective gears, in order to maintain a safe working environment. So that is one side of the coin. The other side is to access government services, there's no requirement for mask or for you to present your vaccination card. So my advice at this point in time, because of the two extremes, we should still be able to walk with our mask in our pocket if we're required to enter some private sector entity, or we should be able to, like our ID card, have our vaccine card available in a likewise manner in case it's required.
Over the weekend, at least two business entities, they would have stopped water flow upon entry. The Gazette speaks specifically that should be maintained for hand washing purposes.
Yes, so we can do hand washing or sanitizing, either or. So, and some people have a preference to using water than to use the chemical. But I think they should be encouraged to have both available.
Plus with a temperature check?
No, that is not required anymore.
That is not required.
That's not required anymore.
Okay. But you still have certain places that do have the temperature check. If that temperature check goes above, well, what are the options? Are the options still as before when that guidelines was fully in force?
Well, yes, because that is what will sound the alarm bell. So if somebody's walking through and the temperature check is extremely high, they should be alarmed as much as those who are monitoring the system. Well, hey, there's a problem here, and what is it all about?
We've seen large gatherings of recent time, and those gatherings before the lifting of restrictions permission had to be sought for those gatherings from the COVID-19 Taskforce. What happens now with permission for these large gatherings?
Well, as I said, the task force usually monitored what took place in terms, we've had requests for cricket and football and all these other. We were able to monitor these activities and look at, and that in itself helped to curb some of the deviant behaviors. But now that the measures have been lifted, there's no requirement to get a permission from the task force. However, if it's an activity that requires that kind of public, the large numbers, and it is going to have music or entertainment, they need to get in touch with the police and apply for what it's called the music and dance permit, and then the police deals with it in that way.
Just before the president and the Ministry of Health would have lifted so many of the restrictions, there was a Ramadan guidelines published. And then within 48 hours or so came the change that the president would have signed off. What happened with that Ramadan guidelines? Because a few Muslims, masjids are asking what happened now with that guideline.
Well, like for over the years, all the religious activities would have had an advisory to help to condition how the activities flow. So for Pagwa, I was in discussions with the Hindu community, and they were concerned about the use of alcohol during their Pagwa celebrations. And similarly, we've had discussions with the Muslim community, and that's how the Ramadan guidelines evolved. However, subsequently, as you said, within 48 hours, all the measures were lifted. So there was no requirement anymore. However, in the new measures, there's still a requirement for sanitization at the mosque and other places of worship, or those that require you to be barefooted. You must have facilities to wash hands, feet, and sanitize.
And what about at Ramadan time? It's the dining element of it.
That's permitted, right? It's just that the leadership of the mosque, the communities, they have to put systems in place to ensure that it's done in a proper manner. And but the iftar is permitted at the mosque.
And what about people now who attend places of worship that still want to observe COVID-19 protocols and guidelines? Should they still be encouraged to do that at places of worship, or people should now want to be free to do social distancing, or that should be provided for in places of worship?
Well, as you were referring to the Ramadan advisory, and even to the Pagwa celebrations, there was no restriction on capacity. All of those were, taken away by the measures. No restriction on capacity. However, the human nature, as I said, we were based on the guidelines and how we condition these measures for the public. We were looking at public behavior, and most naturally, after being conditioned for the past 2 years, some people still, feel safe in doing what they were doing.
Especially people who know they may have underlying conditions.
No, that's one. Secondly, people who would have suffered losses.
Right.
And who would not want to go that way again because of past mistakes or past issues. So they have learned the hard way, and they want to be more cautious. So yes, indeed, there should be no way, or there should be no prevention of them to worship in a way that they feel comfortable, until we come back to norm. So this measure in itself is helping us to be able to cope and to condition ourselves post-COVID. But mind you, COVID is still with us. It hasn't, but it's an opportunity for us to see how we can operate post-COVID. And for some, they will keep on wearing their masks until they feel safe. For some, they will do social distance and physical distancing. They won't go to many activities that they would normally go to because of that risk. And for others, COVID will always have that pain when they think about it, because they would have lost loved ones, they would have suffered, and of course we know about long COVID, in which people will continue to have symptoms and the illnesses that is associated after COVID.
Right, this is Health Matters, and we're talking with Colonel Nazrul Hussain, Director of COVID-19 Taskforce. We'll have more for you after this break.
Did you know that even though it's optional to wear a mask, it's still important to protect ourselves against the spread of COVID-19? A message from the Ministry of Health.
Welcome back to our program. It's our final segment, and as I mentioned, we've got Colonel Nazrul Hussain. Leading up to the restrictions, there have been a few large gatherings. We've seen a bit of Mashrumani. One of the gathering that was really singled out, if not big, but it was sort of a good size, was that energy conference. That showed a lot of movements of local and people from overseas. Then came the reaction, the restrictions lifted into Pagua. We're going to have Ramadan with a lot of movements of Muslims at various masjids. And then we look at Easter coming up. Do you think that this will go right into Easter?
Yes, because as it is, looking back at energy conference and the MASH activities, we have had government-sponsored MASH activities at the stadium, and if I must say so myself, but the Pagua was sensational. And when we look at these activities and we look at our cases after, there's nothing alarming. And so we're going to use those same measures to take us to Ramadan and to Pagua. We also have some other activities, and we have races at the end of this month. The motor racing circle, they're going to be happy for their big races at the end of this month on Sunday, I think. And some of the activities also associated with Easter kite flying would be the regatta in Bartica and the rodeo in Letem. So these are definitely large gatherings that, people are accustomed to.
But interestingly, in these large gatherings, you're seeing in their promotion COVID-19 guidelines in force.
Well, remember I was telling you we are so preconditioned now after 2 years of COVID and how it has us.
Yeah.
So a good thing to say is that, okay, yes, I'm going to have this activity and I'm going to put all the COVID measures in place.
Okay.
But definitely there is really no measure. There's no requirement for masks. There's no requirement for capacity. There's no requirement for social or physical distancing. So it's just that we are now conditioned to be safe or to do things that will keep us safe. Is maybe some kind of self-preservation, as I said. So it's a behavior change. And maybe I can't pronounce it, the behavior scientists could do, but we're just looking at it on the ground in layman terms to see how, people are reacting. And definitely, in as much as some segments of society will discard the mask and want to catch up on all the parties that they missed for the past 2 years, there are some segments of society that will continue to observe it and maybe to transition in a slow but sure and safe way, because at some of the places of worship, people are still practicing COVID measures. In some of the minibuses, the school children and the older folks, they're still wearing their mask. So as I said, this behavior will be with us for a while, and it's a good thing because if there's any spike, it's not hard to transition from hardly any restrictions to more restrictions.
Interestingly, as we see a lull on that dashboard, one would want to imagine or think that you might find less testing being done. But there's still need for a vaccine. Do you think there will be a need for still messages for people to continue taking their vaccines, and especially boosters?
Yes, we'll always need that. So there's a lull indeed, but the Ministry of Health will have to maintain that infrastructure as we move from this emergency mode, pandemic mode, to a more structured and organized way of doing things. So we will have to have the fixed sites for vaccines going on, fixed sites for testing so that we can monitor the level of the infection rate, etc. So that is necessary until we can say, well, COVID is no longer with us, and it's transitioned from pandemic to endemic.
Bottom line is we're still in a pandemic.
Correct.
And as you said, the encouragement is there that people must take all precaution. As I think the minister's headline, it's now, as he said, it's now all up to you. I saw that quote. I think that was, if I got those words together, he now has put it in the domain of the public, as if it's to say, well, it's your call.
Indeed. And as I said, I did allude to it, it's how COVID would have affected us and how we want to respond to it. So it's our call. Did we take the vaccine? Are we safe to go out there? Are we safe to go to work and get back home and keep our family safe?
Mm-hmm.
So definitely it now becomes a personal responsibility. And I think some of the messaging from the ministry should now be targeted in that way.
The other thing that's opened up, and also even though the requirement is vaccines and testing, more people now will want to travel overseas. And that runs the risk of somehow, some people falling through the loophole in terms of testing to bring it back. That also can send, mass travel is also a risk.
All right. Well, as I said earlier, that is one of the main measures that we held on to:
right.
Testing and vaccination requirement to get into the country, and not just at the airport, but at the seaports, at the land, at Molson Creek, at the Latham Crossing. So those requirements are still in place there. But in terms of vaccine, I know that our vaccine rates are still pretty low, but some people are seeing the need to do it, so they are going to get their vaccines, they are going to get their boosters and so on. But testing, we still have to encourage them to do testing. That's the only way we will know if the COVID is still out there, and where it is.
As we wrap up, there is going to be one more major event to happen, and that was released from the Ministry of Education. School will be full-time, face-to-face, immediately after the Easter holiday. So that's going to be another lookout, because that's going to be packed minibuses with adults and children. So that will be another key area to look at.
Correct. So the Ministry of Education would have already done it in a smaller way for the specific age groups. So now that school is going to be fully out, I think they are now more geared for that. I must say that a lot of people, in as much as will be cautious about it and it might be worrisome to some of the parents, they will still have some kind of satisfaction, because children have been home for such a long time. Teachers have not been doing a full day's work. So to get back out there to do what you do best, or to do what you like, there'll be some level of satisfaction. So, of course, as I did allude to behavior issues, we know that COVID has taken a toll on a lot of people psychologically, and getting back to norm is a good thing, basically. It's just that the COVID Taskforce tried to monitor and ensure that we don't have deviant behavior that could put sectors of the public at risk.
Colonel, thanks a lot for being on our program on health matters. Colonel Najrul Hussain, the Executive Director of the COVID-19 Taskforce, telling us all about his department. Thank you for watching. I'm Nazim Hussain. Do join us again next time. And until that time, be safe.